Hello, and thank you for joining the Thomas Expert Series. We're going to go ahead and get started in just a second. I just wanted to make sure everyone has their microphones muted. This Expert Series will be recorded and placed on demand, so please let your colleagues know if you enjoyed this presentation today. At this time, I'm going to go ahead and turn it over to Brianna Miles, the product manager for SOL-M, covering blood collection in clinical pathology.
Great, thank you. Hey everyone, my name's Bri Miles. I'm the product manager here at SOL-M, and I cover our blood collection product line. So very excited to talk with all of you today about blood collection within pathology. So I'm going to go ahead and share my screen real quick. Can we see that okay?
Yes.
Awesome. All right, let me go full screen. Still good?
Yep, there we go.
Awesome. Okay, I am going to go ahead and stop my video while I present. But if there is any questions throughout the presentation, please throw them into the chat so we can get to them at the end. We're going to have some background about blood collection within clinical pathology, and then talk about some of the solutions that SOL-M can provide for safer blood draws for clinicians. So kicking it off, so there's a lot of challenges within blood collection. About 41% of phlebotomists incur injuries from blood draw procedures, and there's over 1,000 injuries per day. This is a really high rate of needle stick injuries that can lead to a lot of different risks, within that being cost or anything in that capacity. So what we really want to go over today is where these blood collection challenges are occurring, and then, like I mentioned, what solutions SOL-M does provide that can lead to a safer blood draw. So the cost of injury, like I mentioned on the previous slide, can be really high for various different reasons. So the average amount that an injury can cost due to a needle stick injury is between $71,000 to $5,000, depending on the treatment provided. So I know that is a very large range, but that is because based off of the results of the initial test or the different protocols of a clinician, there might be different types of follow-up necessary. But the big four things that people mention that the cost of injury can result in is baseline and follow-up testing. So it might require them to get tested every 3 to 6 months after the needle stick injury, treatment of the personnel. So if there is, heaven forbid, something that did incur because of the needle stick injury, the necessary treatment afterwards, lost productivity and time to complete paperwork. So all of this has to go through safety teams. So anytime an injury does occur, there is a lot of paperwork and a lot of documentation that does have to be completed because of it. And then naturally the emotional and societal cost of it as well. This can be very scary for a clinician if this did happen to them. And if anything did result from the needle stick injury, there might be societal cost as well. So a lot of different things can occur because of a needle stick injury. And we just wanted to highlight why this is so important to be aware of, and what different things clinicians mention the cost of injury can be. So when do injuries occur? If you look at this pie chart, a vast majority of it is during use or after use before disposal. So the major reason is during use system. So when somebody is removing the needle from the patient's vein, they could accidentally stick themselves. And then after use before disposal, sometimes when people are trying to turn on the safety mechanism of an item, if the blood collection device isn't that great of a device, if you will, that could also cause the result of a needle stick injury. This still does occur during and after disposal, and then naturally just some miscellaneous times as well. But like I said, during use and after use right before disposal is going to be when the vast majority of needle stick injuries do occur. So Sol Millennium has a lot of different solutions that we'll go over in the next few slides to make the process of a blood draw as safe as possible to reduce the risk of a needle stick injury, both during use and after use, while turning on that safety mechanism. So item overview of the 3 items we'll discuss in the different ways that they are going to help reduce that risk of a needle stick injury is our safety multi-sample needle, or a straight needle, a standard blood collection needle, just a manual retraction, and then our new spring activated safety pull button blood collection set. The best way we describe these is good, better, best. So all 3 of these are going to be very effective ways of reducing the risk of a needle stick injury. But the pull button that we'll go over last is going to be the ultimate way of reducing that risk. So starting off with the safety multi-sample needle, I'm going to go ahead and put all of the different features here up on the screen at once. But we're not going to go too into detail of the features and benefits of just the general needle. What I really want to focus on is how our needle is as safe as possible for the clinician, and the different ways that we have tried to redesign a very simple product like a straight needle to be as safe as possible for the clinician using it. So the first thing that we have on our needles is our needles, the entire needle hub includes that color coding for the gauge. So in case you need to know what gauge you are inserting into a patient's vein, it is nice and intuitive that allows for the clinician to always have that visual representation of what gauge that they did grab for that blood draw. The other thing that is very important and kind of the biggest thing about our needles is most people have a hinge-on mechanism of their straight needle. We actually weld on our safety arm to the actual needle, so there is no chance of that safety arm breaking off. So if you think back to how vast majority of needle sticks are during use or right after use when they're turning on the safety mechanism, a big thing that can happen with straight needles is that when you go to press your thumb against that safety hub, if it isn't firmly hinged on, it could break off and cause the clinician to stick their finger while trying to turn on that safety mechanism. So we purposely weld ours on so you're not going to be at risk of that breaking off, allowing for safer activation. The other thing to note of ours is our safety arm is a bit wider than others in the market as well. So if you think about that, that allows just more of the surface area of your thumb to be covered during use, during the activation use. So it once again helps reduce that risk of a needle stick injury. So that is our safety multi-sample needle. And then we'll move over to kind of the other side of blood collection and talk about our 2 different butterfly needles we have. Starting off with our Soul Care safety blood collection needle. This is going to be a very standard butterfly needle. You have probably seen these in the market before. Let me go ahead and throw these all up on the screen real quick, just so I can talk through all of them. But once again, I'm not going to go through the different ways that we have features and benefits, but I mainly want to focus on the safety aspects of our wing set. So our wings have a translucent hub. So during use, you're able to get a clear view of that flashback. So that way you're not having to insert the needle in and out of the patient's vein. You're going to get that nice visual representation that you did properly hit the vein to know that you can proceed with that blood draw. The important thing with that is, once again, going back to that during use portion. If you think about how if you have to re-stick a patient because you're not sure you hit the vein, removing the needle and reinserting it, of course, puts you at a greater risk of a needle stick injury. So the flashback component is going to be very helpful to help ensure that you're not going to have to keep re-sticking a patient. And then we also have an audible click when you do activate the safety mechanism. So it is really easy to activate. How it works is the needle and the wing set are attached actually to the tubing here. So once you're done with the blood draw, you remove the needle from the patient's vein, and then you slightly pull on the tubing while holding the translucent hub, and the entire needle retracts into that translucent hub and allows you to have that click to know that the needle is properly redacted into the hub, and then you can dispose of it into a sharps container. So it's a really fluid motion, and most people are very comfortable with manual retraction wing sets, but we've gotten really good feedback from phlebotomists and nursing that our manual wing set is a very fluid motion. So they never have issues with it retracting into that hub and helps keep them as safe as possible during use. And then lastly, we have the pull button. So this is going to be the gold standard in the market. If you're not familiar with spring activated technology, this actually allows for retraction while in the vein. The reason that this is so important is that if you are able to retract a needle in vein before it leaves a patient's arm, when done properly, you can reduce the risk of a needle stick injury by up to 80%. This is incredibly important and a really good stat. So this is going to be the safest item we have in our portfolio to keep everyone as safe as possible during the blood draw process. So the way that it works is we have this really large arrow that shows obviously where you would pull back on the hub to allow for retraction while still in the vein. There's little springs that are inside that you can almost kind of see in this picture here that allows that needle to snap back into the hub while in the patient's vein. So your hand is never near the needle after it's been exposed to a patient, allowing for that reduced risk of a needle stick injury. The other beneficial thing with ours compared to others in the market is that we require 2 times the amount of activation force. While that might sound like it's not something that is a positive, it really is, because it requires you to be very intentional with that retraction. Others are very finicky in the market, and so it can cause accidental activation during insertion in the middle of the blood draw that can increase that risk of a needle stick injury, where being very intentional with ours will allow for an even safer blood draw. We also have flashback on this, just like the item that we previously discussed. So I won't go too into detail of why that's so important, but since we already did, but just know that this item also includes that flashback component. And then we also have our wing sets for this item are about 30% wider than others in the market. And the other reason that this is so important from a safety mechanism is if you are somebody that likes to hold on to the butterfly wings during insertion, it's going to allow for additional stability during that insertion, once again, to reduce that risk of a needle stick injury. So we try and find different ways to have a standard item like a butterfly needle or a straight needle be as safe as possible. But we wanted to go over where we see a lot of the needle stick injuries occurring and what our R&D team does to help reduce that risk and keep everyone as safe as possible during the blood collection process. So that wraps up the presentation portion of this. I'll go ahead and stop sharing real quick. We can open it up for any questions.
Brianna, thank you. I have a question. Are there a lot of spring activated butterflies in the market?
So there is not. There's only two items in the market, us being one of them, for spring activated technology. So it is not as common, and it is a little bit more rare to see, which is why we're really proud that we were able to launch ours within the last year so that we can help bring additional safety measures to the market.
Great, thank you.
Thanks. What have you seen is the best way to prevent a needle stick injury? So as I mentioned, the stat of if you're able to do an in-vein activation, when done properly, you can reduce that risk of a needle stick injury by 80%. So that in-vein spring activated technology is hands down the best way to prevent a needle stick injury, because you're essentially removing that risk of having a needle stick injury after use. If you refer back to the pie chart that we did in the first few slides, the risk of a needle stick injury when you're trying to activate the safety mechanism is around 40%. So if you're able to activate the safety before it ever leaves the patient's vein, you're almost entirely removing that portion of the pie chart and removing that risk. So definitely going to be the safest way to retract a needle. Any other questions?
While we wait for more questions to come in, I'm going to go ahead and show you guys this environment. In here, I wanted to show you the promotion that SolM is offering. So make sure that you take their survey. And in here, you will also find a ton of different literature, web links, as well as videos. So please be sure to hang around the environment and explore after this talk is over. And send it back to you, Brianna.
Great, thank you. I think if there is not any other questions, that does wrap up the blood collection within clinical pathology presentation. So thank you all for joining us today. I hope it was helpful to see different solutions that are available within the market. It was great getting to present to all of you.
Thanks so much, Team Solam. We appreciate it.
Thank you.
Thank you.